Bonjour, je pense la première journée
Hello.
était excellente.
I
Mais je
think
pense que
that the very
le meilleur
first day
moment,
of
c'est
work that we
maintenant.
have had was absolutely excellent,
On
but
a
right now the
22
best moment is
5 à
coming because we have
économiser en 40 minutes.
22.5
Donc,
billions that
je
must be
suis
saved
vraiment
in
impatient
40
d'avoir
minutes,
vos
and
propositions.
I'm very
Je ne vous
impatient
présente pas
to
parce que
hear
je vous
your
connais.
proposals.
Je vais me
Well, I
tourner
will
tout de
not
suite
be
vers vous,
introducing you
Thomas.
because everyone knows you
En
already.
tant qu'un
I would
peu
like to give you the
expert
floor
extérieur,
first, Thomas,
j'ai le
because you are
sentiment qu'on a
an
toujours été en
outside
crise.
expert,
Mais là, j'ai
and
vraiment le
I
sentiment que
actually have this feeling
c'est un
that we're
moment
always
grave.
living
Est-ce que vous
within a
pouvez nous expliquer
crisis. But I
pourquoi,
believe that right
à
now the
l'heure actuelle,
moment
c'est
is
plus grave qu'il y a
particularly
quelques
serious.
années?
Can you please
Merci
explain
beaucoup
us
de me donner la
why right
possibilité de
now
mettre
is much
une
more
excellente
serious
ambiance
than
dès le
several
début
years ago? Well, thank you
cette
very
table
much for
ronde et cette
having
matinée.
created
Oui,
this
c'est vrai,
absolutely
la situation est grave,
fantastic
elle est assez
atmosphere
inédite.
at the beginning
Pourquoi?
of
Parce
this
qu'on a ce
roundtable. Well,
déficit
yes, right
très
now the
important de
situation
sciences
is very
humaines,
serious.
évidemment pas
It's
seulement de sciences
unparalleled
humaines, ni
because
de
we have this
l'EMC,
very
mais
important
principalement
deficit
pour les finances sociales
for
et
the
celui des
health
assurances maladie,
insurance
plus de
and
16
also
milliards
for
d'euros
the
de déficit.
financement
On est
for the
habitué
insurance.
malheureusement,
We
c'est vrai
have
depuis de longues années, même si à
16
la fin de
billion
l'année civile
euros of
2010, on était
deficit.
quasiment arrivé,
Unfortunately,
il y a
we
10 ans,
are
on y
kind
était
of
quasiment,
used to
c'est
it
un peu plus.
because, well, 10 years
Et ce qui est
ago, just
inquiétant,
before
c'est
COVID,
qu'on est
the
sorti
situation was
évidemment
very much similar
d'une
to
crise exogène,
today's situation.
du Covid
But we
bien
were
sûr,
able to get
sans quand même
out of the COVID
oublier la
crisis
crise de l'inflation quand
without
même qui a touché
even
fortement le système de santé.
mentioning
On est
the
sorti de
inflation
là et
crisis
on
that
remonte
also
encore des
affected very much
déficits
the
à hauteur de
healthcare
16
sector.
milliards.
And
Donc
right
ça, c'est
now
pas
we are
inquiétant, surtout on
basically
n'a pas
getting
de
back to the
perspective à ce stade
deficit that
de
was at
redressement
the
de
very
l'assurance
beginning
maladie.
of the
Les
COVID
premières
crisis.
prévisions
And right
de
now
celle de
we
la
no
Commission des comptes
longer
sont du
have any
printemps et
prospects
elles
for
ne
getting
montrent
out of
pas
this
de
deficit. And
retour vers
we
l'équilibre. Et
see
donc,
that we don't
on est
really,
durablement,
there
pour le
is no
moment, en tous les cas,
trend
dans une situation
for
de
finding the
déficit très
balance
important et qui va
anew.
s'accumuler
So
et
I
qui fait
believe
qu'on
that
est
this
en train
situation
d'aller
is
vers
very
des
important. And at the
niveaux,
same time, all the factors are being
notamment de dette à
accumulated.
court
So it
terme, à
actually
financer
pushes
du côté de
us to the
l'URSSAF qui est
level of the
stationnaire.
debt in the short
Des
term,
problèmes de
so
liquidité,
that
ils
to
savent
finance
prendre en charge, mais
URSSAF as well.
ça va
So we
s'accumuler,
definitely
il faut faire
have a
attention à
problem with
l'effet
liquidity
boule de
right
neige.
now,
Donc
but
oui,
this is
et si je
also
peux me
something
permettre
that will
aussi,
have
intéressant que
this accumulative
cette
effect.
table
And what
ronde
is
et
also
au-delà
very
traite de ce
interesting for
sujet,
this
on parle
round
beaucoup de
table and also
retraite,
for
c'est
Sham is
important, on
that we're
parle beaucoup de
talking a
finances
lot
publiques
about
au global et c'est
retirement.
important.
We're talking
Mais la
about public
prise de
finances
conscience
globally,
de
that's
l'ensemble
important,
des
but also
acteurs
the
de santé, pas seulement
awareness,
de
the
l'ensemble des
awareness
parties
of
prenantes de
all of
cette
the
difficulté
stakeholders.
financière
All of the
absolument
stakeholders must be
majeure
aware
et
of
des
this
risques qu'elle fait
major
porter sur la
difficulty and
soutenabilité et
the
donc sur la
risks that
protection de
this
l'assurance
represents
maladie
for the
apporte
sustainability and
à
also
nos
for the
concitoyens.
protection of the
Je pense que
healthcare
cette prise de
insurance
conscience,
and
elle
the
est
costs for the
encore
citizens. I
beaucoup
believe
trop
that
limitée.
this
On fait
awareness
comme
is
si
still very, very
on allait pouvoir
limited,
continuer comme
all
avant.
too
Ça
limited.
n'est pas vrai.
We
Et
are
on ne peut pas non
continuing
plus
as
attendre
if
2027.
nothing that was
Ça n'est
happening
pas
and
vrai.
we could
Donc
continue
comment
as
on
we
met
are
en
going
mouvement
on
On en
right
viendra
now.
certainement
But this is not
du court
true.
terme,
Starting
du
from
moyen terme, du long terme.
2027, we will already
Merci
feel
beaucoup,
it. So we
Thomas.
have to
Alors,
think
pour
about it
cette
for the short term,
session, moi,
mid-term,
j'ai
and
beaucoup
long term as
changé
well.
pour vous. Alors,
Thank you
je
very
vous dis que
much,
c'est pas du
Thomas.
Shakespeare.
Well, I would like to
C'est
tell
une
you
catégorie.
that for this
Mais on
specific
apprend
session,
beaucoup de
it's
choses.
not
Ça, moi, je
really
recommande
Shakespeare,
à
but we are
beaucoup de
actually
lire ce livre
learning a
parce
lot
que
of
c'est très,
things.
très
And
important en
well,
termes
I
de
have
facteurs.
read this
Alors,
report,
mon
Expenses and
sentiment,
Income
c'est qu'il y a
2025, just as many
formes
people will.
d'économie.
Of
Il y a
course,
deux
this is
formes
not like a
d'économie. Il y a le
literary work, but we
conjoncturel.
learn a lot
Nous,
from
dans notre
here.
domaine
So
de
I believe
recherche,
that
on
we
appelle
have
ça la
two
régulation
forms of
pseudo-réelle.
economy.
C'est-à-dire
The
qu'on
first
met
one is the
le
conjunctural
curseur
one,
un peu vers le
and
haut
there
ou
is
vers le
this
bas.
regulation just
C'est
as for the
parfois vu de
heater when
manière
we are
très
changing
péjorative, le bilan
basically the
bravo, le vide
indicator
comptable,
and
etc.
increasing
On
it
sent
or
que c'est
decreasing it.
efficace.
But we
Et puis,
actually
il y a les
believe that this
réformes
is
structurelles,
efficient.
les
But at the
actions
same time, we
structurelles.
also have the
On en
structural
voit
actions, the
deux
structural
parcours
reforms. We can
pour
see
prendre des
basically
mots-clés et puis
two different
prévention.
pathways.
Votre
So, well,
sentiment
if I
là-dessus et
can
puis des
use the
actions
keywords,
concrètes
and
parce
we also have
que
the
vous avez
prevention
ouvert, nous
here.
demandons des
So,
actions concrètes.
Elizabeth
Donc,
Hubert is actually
pour qu'on
asking
sorte
us
avec des
to
éclats.
suggest
D'abord,
something
merci
very
d'être réparti
concrete.
en effet de
So,
ce chargé de
what would
produit
you
qui vise à
like
répondre
to pretty
à
much
cette
tell
prise
us
de
about this?
conscience sur le
Well, thank you
diagnostic
very much for
et à
having
essayer
mentioned this
d'éclairer et à
report
essayer
about
aussi,
expenses and
on a pu me
income.
poser un
I
constat
think
sombre,
that it was
et
very
être
important in
optimiste.
terms of the
On peut
clarifications, and we are
sauver le
basically
système
trying to
sur le
be
temps. On
optimistic
peut
because this
ensemble,
is also
avec l'ensemble
something
des
that
parties
is
prenantes, on peut
possible
sauver le
all
système
together with all the
avec un triptyque
stakeholders within this
prévention,
system, with
parcours de
this
soins,
triptych:
organisation des soins
prevention,
et
the
juste soins
journey
au
of
juste
for
prix.
the treatment, and the
On a fait
organization of
60
the treatment
propositions, je
at
vais
the
vous les
fair
épargner
price.
évidemment.
We have
Par contre,
basically formulated 60
je proposals in this report about that. Well, I will not mention all of them, but we have been asked, and the scope that I wanted to share with you is that we actually have to do absolutely everything. So we have to work at the conjunctural and structural level. We have to work on the prices and on the volume as well, and we have to question ourselves, of course, about the prevention and the treatments. So the scope of the situation that we see right now in front of us makes us highlight the necessity of using absolutely all the levers. So we cannot say, yeah, we will not lower the prices because this is not very smart, but the prices, when they are too important, this will be bad as well. So just for the prices, if you allow me just one question, a lot of people say, well, yes, okay, we understand that there is this constraint, but probably pluriannual character. Well, yes, for the pluriannual character, we have been talking about the political context, which actually complicates things here. And once again, quoting this report about expenses and income 2025, we are saying we have to build this new horizon for 2030. Well, we understand that this can be a new horizon horizon, because in 2 to 3 years we will not be back to the previous situation, a better situation, which is why we actually have to fix a certain goal to create a certain strategy. Well, right now we have these 3 pillars, and we believe that, well, following this logic that has been built together with the social partners, with the National Health Insurance, CNAM, and so on, well, of course, we have some measures that are part of all of this, and this is like a key, like a system. So yes, of course, we have to question many things, but we have to create these targets, this prospects, financial prospects as well. Well, we have sustainability, and sustainability is here to serve the treatments, but also the innovation and the quality. So we can consider financing innovation, but also to do it at a fair price, and we have to look at the pluriannual point of view. So what will be the concrete actions here? Just a couple of examples. So just to give you one, I think that we have to go, and this is also one of the proposal, to the systemic use or mandatory use of the digital tools for the healthcare by the professionals of the healthcare, because we have invested there and we see that this works very well. We have 22 million people who are already doing all this, so I believe that even the health insurance must also pay for the rates that integrate, of course, the food as well as the treatment. Well, it has to be, we have to have all this individual information per patient. It has to be very relevant. And well, I'm just giving examples just because we cannot do without them. But when we're talking about the labs, but also about the hospitals, all of this has to be systematic, and it has to be integrated within the framework of the negotiations with all the healthcare professionals. So I'm taking just this example, but I can also take another example, which is probably a little bit more risk, but it's very structural as well. We have to preserve 100% of our system, because this is the very core of the health insurance that we have here. So we have to protect people who are part of it and take them in charge. But we cannot have the system identical to what it is right now when we are looking toward 2030, and we have 25% of the population that is basically changing right now. So we cannot stay in the same situation. Well, of course, this is very sensitive, and at the same time we have the patients, all the stakeholders, the government, and so on, which is why we have formulated all of these proposals. And we have to conjugate all this with a prevention that will be much more active, meaning that we have to look at people who are in hypertension or who are obese, and we actually have to make sure that we take care of these people just before they get into the status that becomes critical for them. So I will go back to you, but Stephanie, what does it make you think of with the preparation of the PFSS? Well, there are many points in here. Well, right now the situation is quite complicated. Everyone knows it. When you're a deputy Macron supportive deputy, you understand that, so probably it's kind of complicated, but we have to do things. So I am pretty much in this situation. We have the budget that is about to come, and this is a budget that I would like to say it actually looks like thumbs up or thumbs down. So if it's thumbs down, it will create instability, and we will have this necessity to work toward a compromise. We will have to find this compromise, and well, what you have done here is absolutely great, because together with the CNAM and with the partners and the board of the CNAM and social partners, you were able to create all this work, and everything that is the outcome of this report, expenses and income, can be used by the parliament members, so that to make sure that the stumps will be moving either up or down. So I think that we have 3 blocks of the economy that can be already activated with respect to this budget quite quickly. I believe that the major structural reforms are already known about the refunds, about also everything that has been mentioned yesterday during the roundtables. I believe that unfortunately we'll have to wait until 2027, but we still have some savings, very quick savings that can be done. Well, talking about the prevention, everyone is talking about this. If we are looking at the tertiary prevention, and this has also been said by others, we can act very quickly. For the stroke, for example, if we can avoid for people to go to the hospital with a stroke, this can also save a lot of money. Now, the fraud, also a lot of people have been talking about it. Well, the parliament members are trying to fight against fraud. We have the social and fiscal fraud, and Catherine Mouret has also been mentioning it. I believe that we can basically agree within the assembly on the question of the fraud. And we also talked about the journey, the patient journey, but also the efficiency of the fight against all these different aspects of the financialization. So I think that we can have very efficient measures very quickly, and the measures everyone will agree upon. So you have also mentioned the long sick leaves. I think that here also we can adopt a different approach. Now, if we're talking about the sick leave, if we're talking about the quality of life at work, we can also do something here, because I believe that the positive vision can be had here in terms of the fact that it's never satisfying for our citizens to be on a sick leave, especially in a frequent way. So they have their part of interest here as well. And from the political point of view, we can move forward with it. Do you have any figures? What the savings can represent here? Well, now I'm looking at the figures that are part of this report, expenses and income, and it's about 4 billion, something like that. And this was also the figures from BIO project. Well, we don't really have a legislative text here, but BIO was talking about around 5 billion. So we still see that these measures are very important. Well, just as you said, not everyone agrees with all of these measures, so we will have to look at the details. But still, this is a pathway that is here that allows us to move forward. So this is the tertiary prevention, the ALDs, but also you have been talking about the fraud. Yeah, we were talking about the fight against financialization's pressure. I will not be emitting specific terms, but the Assembly, both the Parliament and the Senate, unanimously has voted for 2023 and 2024 for PLSS, for this French regulation law, but they were thinking about the fixed fee for radiology, for this therapy, radiotherapy, and we actually went back to this measure because we understand that we have to accelerate, we have to have the savings even faster, and also paying for all of this. Well, this is pretty much a very old debate, starting from 2004. We have already been talking about these fixed fees and how they will be introduced. So I believe that this work will concretely start next week, well, at least at the all of this work will start next week, meaning that right now we have to accelerate and to go even faster and further, but we can do it all together. So Stéphanie, what does it basically mean in terms of your reaction with respect to the position of the university hospital centers? How can you pretty much conjugate all this? Well, I agree with Thomas FATOME. I'm not sure that everyone can hear me. No, not really. So, thank you very much. Right now it's much better. So I am absolutely agreeing with the presentation that has been done by Thomas. We actually have this topic about the conscious responsibility and conscious awareness that must be increased, and we don't really have the same goals, and all the roundtables have highlighted it. So we see that the savings of one are the income of others. So at a certain point, we will have to tackle this within the system where everyone has this interest of benefiting from someone else and saying that I want him to suffer and not me. So, you know, I have been talking during lunch about some of the roundtables, and we were like, okay, so who will be the next scapegoat because the nurses aren't here and so on. But I believe that we have to move out of it because, well, this responsibility and this awareness must be done at the collective level. And I have actually heard the presentation of this report, expenses and incomes by the health insurance, and we actually had all the CPTS, regional health community representatives, and so on. We had many different stakeholders, and it's not the first meeting in this setting. So it's always like, what do we start with, and how do we do it, and what is the interest for these stakeholders and those stakeholders? And finally, we are talking about a consensual teams everyone agrees upon, meaning the prevention. Well, but I don't think that someone here can say that we will be able to do it very quickly. The tertiary prevention, something very simple. Well, just an example from my small point of view is the risk of cirrhosis. Well, in the hospital, we will have some patients that will be coming and paying by invoice and so on. And we actually looked all of the patients who we have had for 2 years, and we actually looked at it through the algorithm to look at the different behaviors. And it was actually very interesting because we understand that the preventive efforts only would have been very, very useful for half of the patients. And then, starting from this data, we can basically come up with very interesting strategy for the radiotherapy. This is a very important topic, and we also have all the important topics about around the drugs and around everything that is very relevant for the medical teams, because when we're doing the savings, it has to be relevant. So rethinking the way of treating people from the point of view of sustainability, of ecology, but also of relevance. And today we are coming to this point when we're saying that we're not going probably to save the health insurance, but the environmental footprint can also be an important point here. Do you have a clear example? Well, when we're talking about the paracetamol, how much CO2 is produced when we're producing these drugs? Well, this is also something that influences, of course, the teams, medical teams, and we understand that if we're starting with the savings right here, we will not be able to generate 22 billions, but this is already a starting point and a small droplet in the ocean that can also make a small impact. Philippe, what do you think about this? Well, my point of view, well, I am the representative of those who offer the treatment, those who offer the care, and we are being asked also to participate in the savings. And we also have here a Citizen Act. We have been talking about this report, Expenses and Income, which is absolutely fantastic, but also there is this report of the High Council, and we have been working with this report as well, because for us it was important to work on the return to the balance for all the accounts of the health insurance. And just to take 10 seconds here to say that this coming back to the balance also must be done with the repartition of the income. What do you mean by that? Well, it's very clear. We have three important axes that are increasing this deficit. First of all, this is the refund of the debt generated by COVID, because we are actually refunding the capital for the COVID, and this is actually something that weighs a lot on the deficit. We also have the refund for the reform for the Ségur of the hospitals, because there is no continuous financement here, and just this is what Thomas has already mentioned here, so we all know it. And we are in this mandatory increase of the expenses, because the population, we understand that we can treat them better, but they're aging. And this is a very good news, but this costs us more and more. So we actually have to also explain them and look at it from the point of view of the increase of the expenses, because health is very important, and this is one of our goods that is a basic good for all of us. Well, now we are looking at the expenses. You wanted to react, Thomas? This is also a very sensitive topic and also a politic topic as well, and it also echoes to the topics related to the economy, and I'm totally agreeing with what Philippe BESSET has just said. And for once, expenses and income actually talked about the income as well, not just about the expenses, meaning that we looked at this experience from 2010, but also going back to this balance. Well, these are political questions, but these are also the questions of the choice of how we will allocate these incomes toward the health insurance, because of course we understand that the expenses are quite heavy, but we also have this very important aspect about the environmental that is created here so that to change behaviors, meaning we have this income that is related, let's say, to the consumption of tobacco, of alcohol, and so on. And this is all created in order to stimulate the right behaviors. Probably we will introduce also something about the sugar, or I don't know. But this is also something that will influence the collective health, and it's very well documented as well. And of course, there is a discussion about the income that must be held here. Well, I'm sorry, I do not really agree with what you have just said. Well, from the theoretical and practical point of view, I agree with you, and for the connections, I also agree with you. But the French person, average person, they don't care about all of this. They are paying the money and they need a result behind all of this. And this is part of the global deficit of our country, because we have a part of the tax that is the education, but we also have other taxes that are being paid, and we have 66 billion per year in addition for the health care that we are putting aside for the last 5 years, and this is an important amount. So I believe that by continuing the evolution, or meaning the increase of everything that is being done right now with respect to the growth, we are basically staying within the effort that can be supportable, that can be bearable. And I believe that we have to get out of these discourses that say that, yes, the state must stimulate a little bit the Ségur and so on. But this is not something that will allow us to move forward, because I believe that right now our country is facing the deficit. So we all have to deploy all of our efforts to do this. It must be a collective effort. All right, Philippe, going back to you. Now, let's move to the actions. Well, yes, of course. We basically played this game and we have contributed also to this report. We did all the measures that were necessary. So the sheets with the measures, I would like to mention two of them, one on the prevention and one on the relevance. And these are part of what we generated. So for the prevention, of course, this is very varied. We have many people, and Agnès Bizarre has done many conferences about all of this. This is not just about health. We all know it. This is very clear for all of us. Nonetheless, if we would like to create a culture of prevention in a country, in our country, we have to put together what we call bonus-malus, which is a special prime for the patient. That says that individually we can have a certain bonus or a negative bonus if we are or are not deploying the efforts in terms of prevention. So just to give you a couple of examples, for the negative bonus, well, of course, this will be the taxes on the behavior. So this has to tax the negative behavior. And at the end of the day, we must know how much our behavior costed us. Let's say our behavior because we have eaten too much sugar, or we drank too much alcohol, or we smoked too much. Well, probably this is complicated to do, but this is very interesting because this will contribute to the development of the culture of prevention. Now, my health space must allow to identify that I am doing something for the prevention. I am doing the screenings, I'm doing the vaccines, I'm doing sports. Practicing sports. So this is basically the approach that is interesting here. And here, I basically want to have a certain refund and a franchise, and I believe that this will be the measures that will be an incentive, a concrete incentive for the prevention for everyone. Now, in terms of the relevance, for the relevance, we actually have to go back and to re-evaluate the references that we have here in terms of taxes, and we must do it all together. We must do an evaluation of what is a fair treatment, a fair care. And we actually have here the French National Health Authority that has given us basically a guideline for that. So I think that we have to look at these references and look at it very carefully. And it's exactly here that we will have some points, some strong points that we will have to develop. But I think that the pharmacists and the general practitioners are at the very front line that is very much concerned by all of this, and probably we will have to rely on them for that, to have this fair care and to do the real savings from here. And an important point that has been highlighted by the Prime Minister is that if we're moving in this direction, and if we are creating this real savings, and we can also have a figure put to them, then we will have to have initiatives. Well, now, for the prevention, as in terms of relevance, I believe that the main topic is the operationalization, because we have already talked about all the areas of non-relevance, and we all know it. But now the question is how we deal with all of this. And going back to a question that Stéphanie has mentioned, meaning the wasting that we're using here, I think that this is also very important. It's not greenwashing, but this is just to say that we all are focused on the sobriety and operationality. So we have to, of course, look at it with the nurses, because we know that sometimes the prescriptions are not very adopted. So let's say you have to deliver within a certain period of time, and then we'll have this dialogue between the pharmacists and the nurses and different professionals. And we actually have seen that there was, for example, a clear slowdown in terms of expenses related, let's say, to the dressing of wounds that have been prescribed after we have talked for 7 days to the nurses. And I think that it's the same thing for different scanners, radiology, and so on, IRM. We have been talking about it for years and years, but right now the relevance must be at the operational example, meaning that, let's say, the doctor is facing this assessment, IRM, for example. So they have to explain why they do this. But this, in reality, this does not really happen, and it will not happen. So this is why it's important to actually go a little bit further in this topic and to look at the opposability, to ask ourselves, how does it work in this office or in that office, in this institution or in that institution? Because right now we don't really have these digital tools, but we have tools that are even easier than that to use, but we don't use them systematically. And going back to the prevention, I believe that we all agree on this. But now we have to define what we're talking about, because the health insurance has already created these possibilities, for example, for people to go and get their screening in terms of cancer. So it's for 3 to 4 million people, and they want to work on it all together. But this can only work if we're all in it together. It's the same thing as in the companies. We have the orthophonists, for example, here, and we have to allow them to go to school so that to be screened, to find these problems as soon as possible, as quickly as possible. So all of this has to be operationalized, because we know pretty much what we have to do. But this is very difficult because we have to mobilize a lot of local actors as well as the important intermediaries. So let's talk about the implementation, because all of these topics are not new when we're talking about prevention, but also relevance. We have been talking about it for 10 to 15 years, but the problem of the implementation is still here. And I'm actually thinking about Jean Monnet, who was the best negotiator of the 20th century. He actually said that there were different attitudes to adopt during the negotiation. And it's not judging or anything, I'm just giving you an example. Sometimes we have to step back with respect to the interlocutor, so that to give the impression to the interlocutor that the idea is theirs, so that to create this dynamics. So how can we pretty much implement all of this? So what is your feeling coming from your experiences? Because we think that it's actually there where everything happens. Because right here we see that everything is happening great, but at the same time the implementation is struggling. Well, yes, I totally understand what you mean, and actually it's important to go back to this. I believe that the tool of the convention is a tool of a dialogue that allows us to point all the different topics that we have to talk about. Well, of course, this will be the topics related to the financement, but also the topics of prevention, of public health care, of the relevance. From this point of view, that's a very good tool, but we don't really have to step back here. I think that we have to step back in the sense that we have to listen to the stakeholders to see what we can bring into this discussion. And the same thing as in this example that I was mentioning when we were talking to our pharmacist friends. We will not be doing the screening of the hypertension without the pharmacist. So here, once again, we have offered them to do the same program as in the UK, to do this very important screening of the hypertension. But all of this has to be done with the stakeholders, through these discussions, through this operationalization process. We also have this new program of prevention with dentists, so we are trying to get some excellency right here, and this is a little bit of advertising that I'm doing here, but I think that that's a great approach in order to operationalize all of this. And here also the requirements are increasing, probably the requirements in financial terms as well, because we're not in this logics that are saying that we don't have any money but we would like to do something. Well, if you would like to transform the system, you have to have the ability to do this. That's very important. Well, I would like to react in terms of what you have said about the innovation and in the conventional field as well. Well, I believe that these conventions are including 2 to 3 different professions, but it's important for us to be able to do this, because just as you have said it, you have been doing it in silos, because you have worked with us, but also with nurses and with doctors. So these are the 3 professions that are at proximity. But I would like to have the conventional negotiation with the general practitioners, because they are very important, and the pharmacists. And in this conventional negotiation with 2 professions at the same time, and this will be innovative, because you are doing this conventional system with all together, so we will be like 30 representatives around the table in all of these discussions. And you have actually seen I'm no longer even participating in it because it's impossible. But the negotiation negotiations between different with representatives of a certain profession are very precious, and this is something that we have to maintain, but we have to broaden them to two professions. Stéphanie, what do you think about this implementation? Well, Jean Monnet also said something very important. He said that men change only things that they believe need a change. And I believe that the politics are here to try and anticipate the crisis. And sometimes to also be the bad guy here. Because sometimes we have to say things out loud, things that will not be very pleasant to hear for everyone. And in my experience, when we're talking about, let's say, the advanced practice nurses that have to come into the practice, it will be very useful because in some territories this is a very big need, and it's been months and months since this need appeared. And we're trying to push it forward. Well, of course, no one really likes it, but at the same time, we have to leave a space for a dialogue with social partners here. So, well, this is just a small minus probably that I would like to add here, because we need political courage so that to carry out the reforms are voluntary. Yes, you are absolutely right, Stephanie. The other Stephanie? I think that what is important is for the healthcare professionals or institutions to be a real active actor in the implementation, because we are talking about all these plans, the plans that we know and have known for quite a long time. Well, globally, they are in consensus, probably not around all the measures, but globally. Now, if you would like to operationalize it, to implement it, we have to really make participate all the stakeholders. And we can see that according to the territorial specificity, some issues will not have the same sense, will not make the same sense, meaning we will have diabetes or cancer that is more or less represented in any territory. So we have to unite all the stakeholders. So this is the goal. And then as for the method, you can basically discuss it, you can build it, you can develop it. And I think that this is how we implement all this. And for us, in order to tackle concretely all of these issues at a certain point of time, at a given territory, in terms of healthcare and in terms of population, we must be able to say, well, all right, the politics gave us this goal, so how can we organize ourselves to reach this goal? So what should we modify in terms of organization to get it? So I think that this is the very last mile, I would say, that creates a difficulty in terms of the implementation for us. So I am persuaded that when there is a constraint and you are an active actor of this constraint, you will be implementing it differently in a more efficient way. All right, thank you very much. Now, talking about the method, I think that we actually have to tackle the practical side here. There is something crucial, and Thomas has talked about it before, and this is the digital tools. The digital tools are fundamental if we want to increase the efficiency of all of our operations. We actually have two major tools. The first one is My Health Space, Mon Espace Santé, and this is the tool for the patient. And with this health space of the patients, we can all have the medical file of the patient and also all the operations that have been carried out. And we also have this digital Ségur. And this is a database for the professionals that allows us to look at the same data and to talk about the patients to our peers, but also to talk to the patients. And I see that right now this does not really work, because first of all, the deployment is insufficient. And I'm going back to what Thomas has already said. We have to talk about the obligation of using some tools, but also the incentives probably to use all of them, and the differences in terms of rates for these tools. And so we have to talk to those who produce the software, but we also have to talk to the hospitals, because right now the prescriptions, digital prescriptions, if we take those, it's impossible to have half of the public hospitals that wouldn't be able to do it because they don't know how to do it, and that in a couple of years will be the same situation. I think that this is unbearable. So we actually have to understand this and raise the awareness on these digital tools so that everyone will be using them. Well, I think that about this specific point, it's very easy to say when we have a small pharmacy with 3 people of staff and a small stock. Well, when we are managing, I would say, X prescribers in a hospital and a big stock with many different providers is much more complicated than a small pharmacy. So if we're talking about basic topics, well, for some things it will be very basic. Let's say the conditioning of the pills. How many pills go in a box? And the correspondence between the prescription, what is prescribed, and how many pills are in a box. The correspondence is missing here, so there's no match, and that creates problems as well. Well, I would like actually to go back to the question about the digital tools, because this is a big constraint that we see every single day. And you see that NHS has actually invested a lot in the digital tools for the journey of the patient, but also the prevention. Well, yes, I believe that this was like 10 billion euros or whatever. This was a very important amount. Yes, but we have also been talking about the private sector and the startup, because we have a lot of innovation around AI that exists here beyond the healthcare sector, and we actually have to leverage it. Yeah, I think that we don't really have a monopoly here, so we actually have to encourage everyone and use all these digital tools. That's what we're trying to do here, for example, with everything that is related to cardiology, with the use of OCGs, because we're working with all the stakeholders that are working in the AI, so that to accompany everyone, to accompany the health authorities, to find a combination and to find the products that will be here to accompany and to help the practitioners. So all of these tools will definitely help us, and I believe that in the healthcare space, the digital tools will basically do a great job. But this is not something that is closed, so we have to work on it, and we have to work on it with tools that are being developed by the private sector that will be very good for the patients and the professionals as well. And we have to organize all of this, because look at all these tools that we have for the remote surveillance, for the remote follow-up. So these are very interesting for everyone, but at the same time, when we're looking, let's say, at a nurse, she's working with 5 different softwares. So this is also the topic related to the urbanization and the possibility of integration of all of these elements for finally the patients. Well, I believe that right here, we have been talking about this remote care for a lot of chronic diseases. So we have a possibility to do some savings here, but what would be the actions necessary here? Well, we have the legislative framework that has been developed that right now offers this possibility of using it and implementing all of this, and I believe that this is very clear, despite the fact that it's not very easy to really implement. So now the question is, how can we help those who will be implementing all of this? But what will be the actions here? Well, we have to finance the integration of all of these different tools, and we actually have some startups that are positioning themselves there already, but we have this very important issue here, the integration. Stephanie, I see that you're doubting a little bit, but I believe that this topic is incredibly complex, because on one hand, we have to leave the private sector and the innovation do their job and to encourage them as well. And of course, we have to have some incentives, financial incentives as well, to help them out. So I believe that a lot of different measures are here already, despite the fact that we're talking about this simplification measures and talking about this very rigid frame that has been created recently for this tool. But also I believe that the state should probably also have something like a labelization or certification or licensing something, so that to make sure that there will be a certain choice for everyone that will be somehow limited. And at the same time, so you believe that, well, yeah, I'm talking from the point of view of humbleness here, because that's very complicated. And yesterday someone said that the European level is also very interesting for all of these industries, because the market is bigger here. I think that that's an interesting point, and we should probably explore that as well, because we will not have the means to finance all the freedom that we need to create and innovate. And at a certain point, we will actually have to pay attention to this. I think that with the healthcare, we have already seen it, and for the medical files, electronic medical data and so on, we have a little bit structured this. Well, I could say that probably yes. Well, right now I would like to say that we actually have to accelerate, and sorry, I will be probably unpleasant here, but this digital Ségur, we said at the very beginning that this was something that will allow us to accelerate everything that our friends are already doing, but we actually see that this is not the case, because all of this is very, very slow, and we are dependent on the systems, and right before that we weren't dependent. on all this. So we are actually wondering how comes that we have spent 3 to 4 years developing all these tools, but the systems are very complex. And I totally share the frustration of all the stakeholders here, because this is very, the process is very lengthy for the deployment of all these technologies. Well, unfortunately, we have been talking for 40 minutes, so I would like to suggest you one thing. We will meet each other 1 year later, and we will continue this session. Thank you very much.